Welcome to the Equine Vet Connect Podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect Podcast. This is Dan Carter at Countryside Equine Hospital. I got Dr. Caitlyn back today. If you're watching on YouTube, it's going to look a little different. We're not in our studio.
Nope.
They're actually doing some real medicine out in our studio. Our studio is also our treatment room. So
yeah. Sometimes it actually gets used for what it's designed for.
I know. Usually, which is going to be kind of cool because what we're talking about today. But usually, we film these in the morning, and today there's some like actual medicine happening out there before things get started this morning. So you're actually in the doctor's offices.
Yep.
So if you're watching on YouTube, you're seeing where we sit when we're not working on your horses. So.
Yep.
It's kind of funny. The podcast today is about sleep.
Oh, it's my favorite.
I usually don't like it, but what I kind of laugh about is we all overslept this morning.
We did. Yeah, I love sleep. Sleep is my favorite.
I'm not a big fan.
Oh, I love it.
You don't get bored?
I'm asleep.
Oh, I wake up bored. I'm so bored. Like, I'll just wake up. Like, after about 5-6 hours, I'm awake because I'm like...
See, but everybody's wired differently. Like, some people need only 5 to 6 hours of sleep. Other people need more than that. I am that people.
Yeah, I'm like 5, 6, wake up, bored, let's go do something. Oh, no.
If I don't get at least 7, 8, golden, happy.
Oh, no.
I slept for like 14 hours one time. It was fantastic.
Are you serious?
I was very tired.
Every once in a while, I'll get like 7 or 8, and I'm like, such a waste. I'm so like, I gotta go get this back.
No, my husband ended up coming in and waking me up because he was like, "Are you dead?"
I mean, it'd be like that.
It's like, no, but I felt like I was. I feel better now.
So today we're going to talk about actually sleeping in horses.
Yes.
I feel like this is a topic that we don't talk about a lot. But I think this is really important.
Yeah.
And especially the world I work in, when you're talking about athletes that are on the road, I think about this a lot because I don't travel as much anymore just because I don't want to. But I used to travel a lot for work, and I was in and out of hotel rooms a lot. And you never sleep as good when you're out of town as you do when you're home.
Yeah.
And so I do think, but what's kind of interesting is after a while, I can remember just adapting to, when I was living out of hotel rooms constantly, you got used to it. And it's like, oh, and I started sleeping better. Now I go out of town, I'm in a hotel room, like I just don't sleep.
You're like, I don't have the right pillow, and the lights are on wrong, and there's too much weird noise, and
it's not my bed.
It's not my bed. Yeah.
But believe it or not, sleep is actually really important in horses.
Yes.
And they don't sleep as much as we do.
They do not.
They're probably more on my schedule.
Yeah, I was going to say, when you said 5 to 6 hours, I was like, oh, Dan, you're a horse.
I know. So
they sleep, they need about 3 to 5 hours total a day of sleep. And that's broken into different types of sleep. And so we'll get into that. But yeah, they definitely don't need as much sleep as we do. But while they sleep, it's very critical that they get that deep REM sleep, and we'll talk about that. But sleep is incredibly important for recovery, for healing. That's like I'll get on to people a lot when we have horses that are staying in the hospital for a long time about leaving the lights on, and we'll get into that too. But I'm like, we have got to give them an environment that they feel safe and they can sleep.
We actually, when we designed the barn in this hospital, it was designed based on, like, one of the factors that we put into that was actually the horse's sleep cycle. The way we set up, every individual stall has a light, and that light doesn't broadcast into other stalls because we want to be able to go in and check on that one horse without waking all the other horses up. And that was actually a critical design in our hospital is how can we minimize the disturbance of sleep
Yeah.
when we have some of these overnight ICU cases?
That's when I was in school. Our food animal hospital has these very large overhead lights that they didn't want us to turn off at night. And I would come down to do 3 a.m. checks, and everybody's just awake and restless because they can't sleep.
The teaching hospital, they have a new one now, but the teaching hospital where I went to school at in Georgia, you could not turn lights off, period. And I can remember a lot of horses would just get so sleep deprived, and we knew that it inhibited their ability to heal.
Yes.
And then also just their mental status while they were there, they'd get, it drive them about half crazy.
Yes. They get irritable. They get, I mean, we'll get into all this, but it's very important.
So let's talk a little bit about sleep. Most horse people already know this, but I'll never forget. My wife is not a horse person. Now, she's a veterinarian, but she's small a vet, and it took her a while to figure out which end of the horse the food went in. She's not horse people. And when we first moved into our farm and there was horses there, I'd get a call at least once a week that there was a horse colicking because it was laying down. I'd be like, it's sleeping.
Yes.
They don't lay down to sleep.
Yes, they do.
Yes, they do. No, they don't. And I'm like, of course. You know more about this than I do. I'm sorry.
Horses can sleep standing up.
Yes. Sleep-ish.
Yeah.
Sleep-ish.
They can rest.
They can
standing
rest.
up. We'll say that. They can
Yes.
rest. So they have this really cool thing called the passive stay apparatus, which basically it's a mechanism that works between the stifle and the hock to basically lock those back legs without expending any energy. And so they just lock them, and then they can stand there.
Same thing with the tendon of the biceps on the forelegs. They can lock that back, and they can stand with very little muscle. But like I tell people, that's rest.
Yes.
That's the equivalent of falling asleep in class or on an airplane. Yes, you are resting, but you're not going to wake from that sleep and be refreshed.
Yeah, the brain waves, they've looked at all this with, they're called EEGs, but they look at all the brain waves and the different types of sleep. And when they're doing this standing sleep or the standing rest, it's basically your brain waves are mimicking that of an awake state. It's designed because horses are prey species, and if they need to, get up and go because there's a predator that comes in, they can go on. But again, it's not really sleep; it's more rest. Yeah.
And the brain, the reason we study it is this is actually the only organ in the body that actually needs sleep. And I remember when I learned that, I was like, oh, well, if it's just the brain, I can work around that. So I don't have to sleep as much as everybody said.
Oh, Dan.
So, but yeah, kidneys don't need it. Liver doesn't need it.
They keep on working.
No, they just keep on going. But the brain needs sleep.
Yes, it does.
This is very important.
I had a small animal emergency and critical care clinician spend a better half of her first lecture to our class on the importance of sleep and how sleep works and why you need it, and basically like don't skip sleep to study. And I was like, cool, yeah.
I never did that.
Oh,
I skipped sleep for a lot of other things, but not studying.
But yeah, so it's very important for the brain.
Yes.
For sure. But I mean, the rest of your well-being as well.
So we've kind of got over that myth. And like I said, most people listening to this podcast probably already know that horses lay down to sleep.
They do.
So let's talk a little bit about sleep. Let's go through the phases of sleep, and let's talk about what's actually going on in the sleep cycle.
Yeah. So everybody, there's always these phases. And so you start kind of a light sleep, and then you go into a deep sleep, and then you go down into a REM sleep, which is the deepest, which is the most critical type of sleep to get. And then you go back up to deep sleep, light sleep, and then you go back down. It's kind of like a roller coaster little pattern of sleep. And that's how everybody sleeps. And your brain waves change throughout all of those phases, and you can track those. The deeper sleep is a slow wave, so your brain waves kind of slow down, and everything's kind of cruising along. Horses do this when they're laying down. They can do it standing, but most of the time they're going to lay down for this. They might be up in sternal, so kind of laying up on their chest with their heads propped up on something. They might lay flat out and be in a deeper sleep. But this is when they're going to do that. They usually will do this like in 5 to 15-minute intervals and total up for 2 to 3 hours.
Mm-hmm.
So that's kind of your deep sleep. And then when you get into the REM sleep, this is your rapid eye movement. Your brain is very active during this stage.
Very.
This is when dreams occur. This is when you've got, leg movements and things. But horses are typically flat out and lateral for this, and they are zonked. This is like the deepest sleep that you can get. Usually they'll do it in like 30 to 60-minute chunks, but you're really only getting 3 to 5 minutes of true REM sleep in that 30-minute interval. So,
and that's actually really important. And I assume this would be because the brains of most species sort of work the same. Mm-hmm. And what they've seen in people is that REM sleep is very important for packaging the day's events.
Yes.
Like this is where all the chaos throughout the day gets packaged up, gets put into little boxes, gets organized, stored in place where it needs to be.
Yeah.
And
this is where your memories get banked. Right. Yeah. And then this is also during REM sleep, your brain washes itself.
Yes.
So it basically exchanges all the CSF fluid that's around it, and it rinses itself.
That's pretty cool.
It's really cool.
That's really cool.
Yeah.
Little wash, rinse, repeat.
Yes.
So.
Yes.
So it is necessary for them to get to this REM sleep, and I think about this often from when I was learning about how human brains work, and I started thinking about horses that are in training, horses that are starting to learn new skills. It makes sense to me that this REM sleep is just as important for them as it is for us, so they can process this information, because it's like your subconscious is processing this information. Mm-hmm. And this is why if you talk to people, like I like to keep a notepad next to my bed. Mm-hmm. Because like I'm trying to solve a problem, trying to figure a case out, like I can't connect the dots. And it's always amazing to me. Like I'll wake up from sleeping and all of a sudden my brain kicks in and boom.
Yeah.
There's some things that hit my head.
Because you've had time to connect the dots.
Right.
Yeah, and sort through it.
While I was asleep. Mm-hmm. So then I figured out I have to have that pad there. And so
I used to study in my sleep all the time.
And I started jotting all that down.
Yeah.
So I often wonder if it makes sense to me that I think horses would go through the same process. Yeah. So, and when we talk about, let's talk a little bit about that REM sleep, because you talked about the rapid leg movements. Mm-hmm. You talked about these horses will twitch. Mm-hmm. And I've been in situations where people see that and they're freaking out thinking they have their seizure, and they're going to wake them up and say, no,
don't do that. Please don't do that.
So let's talk a little bit about what that deep REM looks like, and knowing like, let's don't be concerned about that.
Yes. Yeah. So I am slightly OCD and I have cameras on my horse. And I'll pull them up sometimes when I can't sleep and just watch him sleep. Mm-hmm. And they will lay flat out, and typically you'll see them just completely relax. And then a couple minutes later, you'll start to see some leg twitching, some ear twitching. You'll start to see some tail swishing and things like that. Some of them will gallop in their sleep. Mm-hmm. Totally normal.
Yes.
Leave them alone.
Not having a seizure. Don't freak out. Don't panic. They
can also, sometimes he takes REM naps in the middle of the day, like 12 o'clock, 1 o'clock. If it's warm and sunny and nice spring day, he will lay flat out in the middle of the field and take a nap. And it's very normal. Seizures look very different in horses than REM sleep. Seizures they're difficult to watch, but there's a big difference between a seizure and a REM sleep episode.
Well, and I tell people, when you see REM sleep, you may wonder if it's a seizure. Mm-hmm. If a horse is having a seizure, there is no doubt in your mind that's what's happening.
Yes.
And I know that seems weird, but if you look and you're like, I wonder, if you use the words, I wonder if, that's REM sleep.
Yes.
Because when you see a seizure, there is no doubt this is what's going on.
Yeah. And I would say, even if you're questioning it, if you think your horse is having a seizure, please don't get close to them anyway. Mm-hmm. So, like, if you're questioning is it REM sleep or is it a seizure, just leave them alone either way.
Right.
Take a video.
Give them 3 to 5 minutes. If they come out of it, probably wasn't a seizure.
Yes, it was REM sleep. But yeah, please leave them alone. Please do not wake them up.
So let's talk a little bit about creating the environment for sleep, because I think this is really important,
Yes.
because you have to create the right environment so they can go through REM sleep.
Yeah, so like we kind of talked about already, horses they're prey animals, so they are designed to always have that fight or flight kind of at the forefront of their mind, and so they have to have a very safe environment or feel safe to get this REM sleep, to actually feel comfortable enough to lay down and fully like basically to succumb to that REM sleep, because in the REM sleep their muscles are completely what we call atonic, so they're just completely flaccid, relaxed. They are gonna take a minute to like get up and go, so they've got to feel safe. So they need a lot of horses, they're designed to be in a herd, and so they want to have like a sentry horse that's kind of looking out over everybody, one that stays awake while everybody else sleeps, and then they trade off. So if your horse is by themselves, sometimes they're not going to feel comfortable enough to get that REM sleep.
And it's interesting because I've watched this over the years, and I've worked with big herds of horses when I was out west, and then even watching mine, like there's always like when you see them at night, there'll be 3 or 4 laid down sleeping, and there'll be 1 or 2 basically standing guard.
Yes.
And that's a very common thing. And I think this is where we kind of get into some importance when I think about this time of year. When we start, I'm dealing with a case now that's having a vasovagal response. We'll get into that later.
Yeah.
But one of the questions that we asked was, is this horse on day or night turnout? It just switched to night turnout. It's used to being in, sleeping in a stall at night. Now it's gone out at night. And whether that be from overstimulation from being out or not feeling comfortable to go through that sleep cycle, we're starting to see some of these issues show up.
Yeah.
And so let's talk a little bit, like, because down here in the South, you're almost forced into a night turnout situation because it can get so hot. And unless you've got a lot of shade, which, a lot of times we're dealing with places that have the paddocks, they'll have some shade, but it's not feasible to provide shade to all these paddocks. So you end up in situations where you have to go to a night turnout, and this can be quite an adjustment for these horses.
It can, because you think about, these horses that are used to being in a stall, that's a controlled environment. They know nobody can get to them.
Feel very safe.
They feel very safe as long as they have a big enough stall that they can lay down in and get up in without getting cast. It's adequately bedded. Like, that's a great sleep environment as long as there's no lights and things. But you throw that horse out in a pasture or in a paddock that's now got a fence that predators can get through. It's got lots of ambient light depending on where that paddock is, from security lights and barn lights and things like that. And then you've also got weird noises if you're close to the road, or you've got all these other factors that come in that maybe make that horse not feel safe enough to go through that sleep cycle.
When if you look at the habits of the majority of the predators, because the horses haven't quite got the memo yet that the wolves are gone, the bears are gone, no lions, no tigers. They have not gotten this memo yet.
They've realized that we're going to feed them every 12 hours, but they haven't realized that they're not going to get eaten.
Right. They haven't figured this out yet.
Yeah.
And most predators work at night. That is, like, you very seldom see animals such as wolves, coyotes, which coyotes are really not a predator to horses.
No.
They don't really bother them.
Domestic dogs
will.
Yeah.
And even those, they're going to revert to hunting back at night. Most of your predators hunt at night. And so horses have adapted to the fact that, the bad stuff comes out at night. So this can be a little bit of an anxious time.
Yeah.
Until they adapt, and over time they will figure out, like, nothing's gonna eat me out here, so they will adapt.
Yeah.
But at first, when you're switching over to that night turnout, it can cause some sleep deprivation issues. And I've seen it because this time of year people are like, they're just a little sluggish or a little tired. Well, they're not getting that REM sleep. This isn't a nutrition problem, it's not a heat problem. I mean, it could be, but a lot of times it's just we're not getting the sleep that we need because we've changed our routine.
Yeah. The other thing is, sometimes those kind of horses that are always the ones standing guard, like that alpha horse in the herd, or even like the low man on the totem pole that gets chased out of the feed, and they might get bullied out of adequate sleep time, or that alpha horse maybe feels like they can't get sleep because they're too busy worrying about everybody else. That can happen too. So
in one of the things that I want to talk about is, you mentioned this, a lot of horses, they feel very safe in their stalls. Like, this is their, like, if something bad happens, like, a lot of them will go back to the stall because they feel safe there.
Yeah.
But creating adequate space inside of a stall, or an adequate environment with a stall to induce sleep, is very important. There's a lot of factors that go into that.
Yeah, there are, for sure. Definitely want to have enough space, and the bigger the horse is, the more space you're going to need for them to feel like they can get down, get comfortable, lay flat out, and then get back up without getting stuck.
And this is where it's important when you think about when you're building a barn, you want to think about what breed of horse you're going to have. Our stalls here are slightly larger, about 1.5 foot larger each direction than most stalls, because we deal with a heavy warm blood population. And these bigger warm bloods, a typical 12 by 12 isn't 12 by 12.
Yeah.
It's actually closer to 11 by 11.
Yeah.
And so when you have these larger warm bloods, they need that true 12 by 12. They may need, some of them may need 12 by 14. And so you have to look at, if you have smaller horses, Arabians, quarter horses, they can do fine in a smaller stall, feel comfortable laying down. And so this is where I first noticed this was, a lot of showgrounds have put up temporary stalls. They're tiny.
Yeah.
And these horses go into those situations, and by the end of the show, they're fried.
They're exhausted.
And it wasn't the show environment. It's the fact that these horses can't lay down in those temporary stalls. They never go to sleep. So they're being asked to perform at a higher level without the ability to go to sleep, because the stalls are small enough. They're not sure they can get back up. Yeah. And so they just won't lay down.
Yeah. Yeah, it's a problem for sure. And the other thing I would say too is not having adequate bedding.
Yes.
Or like a comfortable space to lay down. You can have all the space in the world, but if you're on concrete with rubber mats and a dusting of shaving over the top, that's not comfortable. Like, horses, they're heavy, so when they lay down, there's a lot of force on those, bony prominences and legs, and it's not comfortable. So you've got to give them enough bedding to be able to lay down and be comfortable, for them to, take advantage of it and get into that full REM cycle.
The other thing, and this is one that I think I'm a big stickler on, creating darkness. Yeah. Like, I can't tell you how many issues we run into from a light situation. And it's people with the best intentions, because they're thinking like, oh, let's leave them a night light. Nope. Let's give them a light. It's like, no. Let's create darkness. Yes. Horses can actually see really, really well at night. Phenomenally well. They like built-in night vision. Oh yeah. And they're not afraid of the dark. Like, you need to have, like we talked about when we worked in some of these hospitals that create light at all times, they can never get the sleep they need. Right. So creating darkness. It's important. And it's even more important when we're talking about mares. If you've listened to some of our podcasts on these mares, regulating the light cycle is how we bring them into heat, take them out of heat. And if they have 24-hour light, these mares will literally go stir crazy because their hormones are completely out of whack. Yes. So you throw ovarian function that's not working like it should, lack of ability to get REM sleep. Yeah. And then you're wondering, can I get some Regimate for my mare that's acting up? And you're like, whoa. She's a mess. Okay. Regimate's not solving this problem. She's hormonal and she's tired, okay? Yes. I'm not touching that. There's some things we can fix before we go to the drugs, okay? Yeah. Let's just say that. But no, light is very important for, circadian rhythms, which is how your body basically knows what time of day it is. It's important. Like we talk about, horses that are, when do they know how to shed out their coat? It's not temperature. No. It's light. It's daylight.
Reproductive cycles. Melatonin gets produced when it's dark. Melatonin helps you go to sleep.
Yes.
So that's all light dependent.
Mm-hmm.
So turn the dang lights off.
Yeah.
Please.
Turning lights off.
It's easy. And it'll save you money on your electrical bill. So.
Well, and the other part of that is make sure you're around your barn or even in your pastures at night.
Mm-hmm.
I think I can't tell you how many times, like I was trying to fix a friend of mine's mare because the mare never had issues and all of a sudden started having issues. And it wasn't until I drove past his place. Now, he's been in that house for years. I mean, we're talking 10 or 12 years.
Mm-hmm.
Actually longer than that, probably closer to 15. Gosh, I'm getting old. And it's always been dark.
Mm-hmm.
They put in a roundabout.
Yeah.
When they put in that roundabout near him, guess what they also added?
Big old lights.
Big old lights.
Yep.
So now his pasture down in this one corner, it's daylight down there at night. I mean, you can see beautifully. This was driving this mare crazy.
Yeah.
And not only from a hormonal standpoint, but also I was like, I bet she's not getting the sleep she needs. Because she's a pasture horse. This horse doesn't come into the barn.
Yeah.
And because she was in that environment, and we're like, hey, let's make a change. We made one pasture change. 30 days later,
fine.
Everybody's great. Hormones got regulated.
Yeah.
And we started to sleep. And I think those two factors play a really big role.
Mm-hmm. Yeah, I think so for sure. Lights, like Dan said, can be very helpful, but they can also be detrimental if they're not used appropriately for sure. Mm-hmm. I guess then we talk about, you've addressed all these things. You've given them a safe environment. You've given them a comfortable environment. You've turned all the lights off. You've given them the proper place to sleep. And some horses still won't sleep.
Mm-hmm.
There's something else going on. Mm-hmm. Usually pain related or anxiety related that's causing that horse to say, I'm not going to lay down because it's going to hurt when I try to get back up.
Right.
And so then we need to go finding what that problem is, whether it's arthritis, whether it's, any other like neurologic disease where it's difficult for them to get up, or, musculoskeletal pain, something that's just, they don't want to lay down. Mm-hmm.
And I've seen this with some of these more severe long-term injuries. Mm-hmm. I've seen it with pelvic fractures, and we know this pelvic fracture will heal, but it is a process. And one of those is these horses don't feel comfortable laying down. It hurts to lay down. Mm-hmm. We're doing all we can from a pain control standpoint, but I'll be real honest. I mean, we should talk about this sometime. Pain control in horses is limited at best.
It's difficult.
It's very difficult. We do not have the scope that other people have because of the side effects.
Yeah.
But you get some of these horses that have these pelvic fractures, and they're literally standing. I mean, we're talking in some cases up to 3 months.
Yeah. Same with radial fractures in horses. Right. Like, they're not allowed to lay down.
Yeah.
And they are exhausted.
Right. Mm-hmm. And the passive stay apparatus is great, but again, that's rest. It's not sleep. And it is a long, tough road in those cases because they hurt. It would hurt to lay down, and they don't. And you'll see these horses be exhausted. Now, we know they'll come through it, but it is an exhausting process.
Mm-hmm. Yeah. And it's, sometimes there's not a whole lot you can do about that. But if you can dig through and get something on board to either A, figure out what the problem is, and then B, get that problem addressed. I've treated an older horse in his mid to late 20s, and he's got some really significant carpal arthritis. And they're like, he's not laying down. He hasn't laid down. And I was like, okay. I did some hock injections to get his back end comfortable. And then I did some Arthrimid in his front end. And they're like, within a week, he's laying down and sleeping. And I'm like, yeah.
So sometimes joint injections aren't just about performance.
Correct. Yeah. So it's, it's just important. But I've got another mare that she lives by herself. She's lived by herself for a long, long time. And she has REM deprivation. Mm-hmm. She's got all the classic signs. She will buckle at the knees, and she has abrasions. Like she's got classic REM sleep, but she lives out in a pasture in the middle of the woods. She's by herself, and she just doesn't have a great environment to sleep.
And as horses get older too, that becomes more and more difficult for them to lay down and sleep because they don't get up as fast as they should.
Mm-hmm. And she's an older.
Yep.
Yeah.
And so these things all play a role.
Mm-hmm.
I had one years ago that kept getting abrasions on her fetlocks.
Mm-hmm.
And the owner's like, I don't understand. Like,
Yeah.
what is going on? Like, I'm not seeing this.
Yeah.
And so got a Nest camera
Yeah.
and put up out there. Well, next thing you know, I'm getting videos. This horse is like going into full-blown narcolepsy.
Yeah.
And we had to differentiate between, is it narcolepsy or is it REM deprivation?
Right, because those are different things.
Right.
Yeah.
Because that was one of the first things they noticed is like when we come in the morning, there's a lot of times there's never any shavings on her. Like we don't think she's laying down to sleep.
Mm-hmm.
And I was like, well, that can definitely cause us to have REM deprivation.
Mm-hmm.
But once we got the camera on, we were able to differentiate. No, this is true narcolepsy.
Mm-hmm.
This isn't a REM deprivation.
Mm-hmm.
And the only way we can figure that out is having these cameras.
Yes.
To where we can watch these episodes, multiple episodes.
Yeah, because they're very different. REM deprivation is just this horse is genuinely exhausted.
Mm-hmm.
And so when you're doing something, or the horse is just kind of standing there and it's not being stimulated, it's in a relaxed state, it will just suddenly drop. Mm-hmm. Because it goes in, the body tries to go into that REM state where those muscles are all relaxed and they will just basically drop and then they'll catch themselves and wake up. That's a REM deprivation.
Yes.
Narcolepsy it sounds very similar. They'll just suddenly collapse, but this is usually during signs or during when you are stimulating them. They're excited, they're getting like groomed or they're running around or something and they just drop. Mm-hmm. That's a narcoleptic.
Yeah, and I've seen it too because when he'd be standing there, he was wide awake in the stall. Mm-hmm. And with REM, you'll see like the head starting to drop.
Yes.
You'll see him kind of going into a sleep mode, and then right at the end they'll buckle.
Yes.
And then as soon as they hit the ground, they almost jump back up.
Yes.
With narcolepsy, he would be standing there looking around, mm-hmm. and then it looked
totally awake,
completely awake, and then it looked like somebody just shot him.
Yeah.
Because he just collapsed, hit the ground.
Yeah.
Boom, right there. And then when he did, he laid over on his side, kind of sat there for a little bit, shook, and then stood back up.
Yeah.
So there's subtle differences. And like I said, if you think some of this is going on, this is where you're using those cameras, getting the videos, multiple videos, not just mm-hmm. one or two.
Yeah.
But we can help.
Because it's got to be repeatable.
Right.
And consistent. Mm-hmm. Yes, that's important.
Because we won't really get into it, but it can also be episodes of syncope, mm-hmm. which is a blood pressure issue. Mm-hmm. So there's 3 different causes there, and the only way we can really figure them out is if we have those videos that we can see the little subtleties in what they're doing.
Yeah.
Because that'll help us figure out what do we need to do. If we're dealing with narcolepsy, are we dealing with a REM issue? Mm-hmm. Are we dealing with a syncope? All these things are treated differently.
Yeah. Yeah, they're very, I remember we had a horse came into the hospital when I was in school that they thought was a narcoleptic, and it wasn't. Mm-hmm. It's just REM sleep deprivation.
I saw several of those when I was in the hospital, mm-hmm. some of these long-term cases we had because we didn't have the ability to turn lights off.
Yeah.
Definitely a design flaw that I carried with me throughout my entire career.
Well, I just think about the horses that were in the ICU, and they're the most critical cases, and they're exhausted, and they have mm-hmm. all this need for sleep to heal, and there's lights on 24/7, and I'm like, oh.
Yeah, that's why I was determined when we built our hospital here. I was like, we will be able to only turn the light on in that stall.
I think when you're looking at healing and recovery, sleep and nutrition are the 2 things that are like most often overlooked, but they're so important. So important.
I'm always reminded, a few years ago when I had to, I was in the hospital having a surgery done, and I had to stay overnight. And I remember thinking, it was like all they taught, like every time they left, like, okay, get some rest.
You can't.
And they were back in there 2 hours later checking vitals. It's like, I'm not critical.
There's beeping and lights and sounds and they're coming in every 2 hours. Like you can't sleep there.
No, and I'm like, you're just coming in to get vitals on me. I'm not even, like, this is an outpatient procedure I'm having in the morning. You kept me overnight because you were scared I wouldn't come back. You were scared I'd get out of there and not actually come back.
They're like, you got to hold him hostage.
I know. You were making sure I didn't like go AWOL and not have the surgery done because I had done that before.
Oh.
So, But yeah, they're coming in constantly. And I can remember when my dad was in the hospital, it's like, Lord, you're telling the man to get some rest and you're waking him up every 3 to 4 hours. Like, and I think that's where, like, when we're dealing with a lot of our ICU cases here, it's like, we're going to watch them, but we're going to have minimal interruptions.
Yes.
Like, we talk to our staff, like, be very stealthy when you go in the barn.
Be very quiet.
If you don't have to turn a light on, don't turn a light on.
Yes.
Like, let them rest.
Yes.
Let them sleep.
Yes.
And that kind of goes to, when we're getting into night check situations, if, most horses, most of the sleeps can occur somewhere around that midnight to 4 a.m. range. That's going to be the heart of sleep. And so I talk to people, it's like, night check's great, but you want to teach people to be very quiet when they're doing that night check, cause minimal disturbance.
Yeah.
And then also don't do it too late. If you have concerns, if you're going to be Caitlyn and be a little OCD, maybe we do some cameras.
Yeah.
They got some great camera systems out there.
Yeah.
If you
Mine
feel
is
like
fantastic.
at midnight.
Yeah.
And this is important. Like, a lot of the breeding farms, they're very big on having these cameras. So they can look through and do those checks without disturbing these horses,
Yes.
letting them sleep.
Yes.
Because they're already about half miserable. They're getting ready to fold. They're comfortable.
They're exhausted.
They can't sleep. They've been working for 2.
Yeah.
And so a lot of those farms have gone to those camera systems instead of physically walking stalls, checking mares. They're going to these camera systems.
And it's fantastic.
Yes.
Yeah. Because all you do is just pull them up and you take a peek at everybody. If you have concerns about one, you can go out and just look at that one.
Right.
Like, the cameras are fantastic. Cannot recommend enough.
And another great tool when you're going through if you have horses you need to check on at night, if you're going through checking, using red lights. Red lights don't activate the same pathways in the eye. And they don't cause near the disturbance. So just a red lens on a flashlight's a great way to walk and check a barn without disturbing everybody that's in there. So
yeah,
sleep, maintain it.
Yeah. I would say, if you are kind of listening to this and you're like, well, I don't know if my horse is getting enough sleep or not, like, signs that you might be looking for in your horses as far as, decreased performance and things. They can be very irritable. They can be very grumpy. They can be just lethargic and drowsy throughout the day when normally they're, perky and bright. Buckling at the knees, the abrasions on the fetlocks in the knees that we talked about, unexplained abrasions on the face can be there too.
Usually on the underside is where I typically see them, lower lip, underside of the mandible.
Yeah. They can't focus. They're not training as well. They're just having a hard time. And you're like, what the heck is this thing doing? But also weight loss, poor coat, decreased immunity, all of that is influenced by sleep as well, because you're not getting that recovery phase that you need. So even though they might not require a lot of sleep, that sleep that they do get is critical.
And like anything, I think about a lot of my horses that are on the road, and I think about this. I sort of think about it in human terms. I know we're not supposed to do that, but it's the only way that I can think to make it relate. If you have a horse, you plan on showing it, it's going to be doing a lot of traveling. You have to get them used to that. Because no different when I was first traveling for work. This goes all the way back to vet school when I was going all over the country shoeing. I was on a plane, and I can remember when I used to jump on planes, I'd get there, I was already jet lagged. I'm sleeping in a hotel. By the end of, by the time I got home Sunday night, completely exhausted.
Yeah.
I was just done. After a while, I could jump on a plane, jump off, go straight to work, jet lag's gone, sleep in a hotel room, wake up refreshed, get home Sunday, and it was just like I'd been, like my body adapted.
Right.
But it took training to do that. It took being in those situations. And so it's no different with the horses, because I've watched this with them as well. When they first start traveling a lot, they're not sleeping as well. Their performance does decrease. But once they adapt to this is what our life looks like.
Yeah.
This is normal.
Yeah.
Like I shouldn't be worried about this. This is what we do. They'll start to develop those sleep patterns as well. Now, some of them, depending on the situation, they can get a little sleep deprived throughout the weekend. But the majority of them, once they get adapted to it, it becomes very easy.
Okay.
It's the ones that show twice a year. when people say, oh, they show too much, like, well, there's a fine line here.
Yeah.
You can show too much, but then you can not show enough.
And every horse is different too. Like every horse's tolerance for what they'll accept as safe is different. Like my horse, he's old, he's by himself. He is like, doesn't have an enclosed stall. He does not care.
Yeah.
He lays down in the middle of the field. He lays down in the middle of a stall. Like he sleeps. He doesn't care. Doesn't bother him. Other horses, they're like very picky. And so they're I mean, we're not supposed to say they're like people, but
they kind of are.
They kind of are.
They all have personalities.
They do. They're all different.
And I think figuring out where your horse is and that. And let's talk, like, because I do believe horses can experience anxiety.
Oh, gosh, yeah.
Like, I feel like they can experience anxiety no different. I mean, it makes sense because anxiety comes from cortisol. It comes from adrenaline. Like, it's a biochemical process. It's not just a mind thing, but it's also a biochemical process.
Yeah.
And there's some of these horses that anxiolytics can actually help them with this. Like, I love trazodone.
Oh, we love trazodone.
We love trazodone. So, and it's an anxiolytic.
Yeah.
And some of these horses need that anxiolytic when they're going to be in these situations. Let's say they're traveling for the first time. Now, obviously you can't show on this.
Right. Yes.
But if you're looking at going to new places, sometimes having that anxiolytic on board just will help all the way around with the situation.
Get them used to traveling. Just take them down a notch and just be like, this is not the end of the world. This is okay.
We're okay.
Yeah, we're good.
We're okay.
Yeah. They're all different though. They really are. Some horses, like you could walk through our barn right now and you're like, ooh, that one's anxious in a stall. This one's fine. This one's kind of in the middle ground. This one is happy to be here. Like they're all just different.
Right.
So
I think if you feel like you're having these issues, don't suffer through this alone.
Yeah.
Talk to your veterinarian about it. Have that conversation. Like, I'm concerned about this. Figure out your next steps because we are here to help with these situations.
And I feel like this is getting a lot more attention too, as far as, the sleep thing goes and everything. There's a lot of products that are coming out now. There's like some masks with like blue light blocking and things for horses because of studies that have come out in humans and, just trying things in horses to see, what helps. So I think, people are starting to pay a lot more attention to this because it's important. So
when is the nature of, as the nature of horse management has changed, if you look with urban sprawl like it is, towns move into the horse farms.
Yes.
Horse farms that were out in the country are now on the fringes of town. Some of them are in town.
Yeah. And there's a lot of light and noise and
right.
Yeah.
And when I talk to people about noise, I was like, it's no different than I grew up living next to a railroad, or I guess when I was in college, I was living next to a railroad track, like literally across the street. When I first got there, I could tell you every train that came through at night.
Yeah.
Within about 2 weeks, no idea there was even a train.
Yeah.
Because we adapt.
Yeah.
And horses will do the same thing.
Just takes time.
Right. So I think that's driving a lot of this because as the light pollution has increased, that's what I'm just going to call light pollution.
It is what it is.
Of it. As the noise increases, you're going to go through these time periods where horses have to learn to adjust, and then you're going to have to make adjustments as well.
Or if you're doing like construction on your place or things like that, like that'll mess them up too.
Well, especially I saw this in a barn where we'd switched over to night turnout and we were doing construction during the day.
Oh, double whammy.
And we had to have a talk like, hey, we got to do one or the other.
Yeah.
We got to figure out a better situation here because we got construction and we're switching to night turnout. We're running into some sleep deprivation. We may have to, they may have to sweat a little bit during the day during turnout so they can be in quiet at night until we get through this construction project.
Yeah.
Made a quick switch. Horses sweat a whole lot better than they go sleep deprived. So
hopefully.
But yeah, you need to look at all these things and really, really ask, like, is my horse sleeping enough? And like I said, even from a training perspective, when you talk about repackaging, you're working on training. So you're teaching them a skill. they need to repackage that skill at night. They need to go through that REM sleep so their brain can repackage and make that a more permanent situation.
And I will say again, the cameras are fantastic. I watched my horse. He didn't lay down for 3 or 4 days to sleep. And I was like, you're not comfortable. And I went out and redid all of his stall mats and re-leveled everything and put all new bedding down. And that night, out like a light. So it's important. Like, it's just, it's the cameras are fantastic. So,
well, that's pretty cool. I never, I remember when I was in vet school, they said that when we were doing neurology, and of course this was 20 years ago, and one of the things they said we weren't going to talk about was sleep because you didn't have enough time to do that in vet school anyway. And now the more we've learned, because we didn't really learn about the sleep cycle.
You didn't?
No, because
that's so sad.
Like,
it's so cool.
Right, but back then, and we're only talking 20 years ago, we didn't put the importance on it that we do now. And now that we're learning, the more we've learned, we realize like the sleep cycle is just as important as all other aspects of maintaining horse care. So.
Yep. Get that brainwash going.
That's it.
Yep.
That's cool. I did not know that. That washes the whole brain like a giant dishwasher.
Yep. Just rinses it.
That's so cool. Takes
all the crap away that it doesn't need. It just rinses it.
That's pretty cool. Yep. So I think that was I never dreamed of doing this as a podcast because again, I knew it was important, but I never dreamed we'd be here talking about it. But
I love sleep, so I'm here for it.
I have no need for it. I'm one of those people, like if I could just take a pill and not have to sleep, which I know they make those, but if I didn't have to sleep again, I would be so happy.
It's so nice. Get all cozy. Just get to.
I just
Dan's like, I can't be productive if I'm asleep.
No, and it drives me absolutely nuts. Like, it takes me forever and I've been like that my whole life.
Yeah, you're just wired wrong.
No, I mean, my whole life. I mean, my parents told me, like, you're the kid that never wanted to take the nap. You never wanted to go to bed. You were always up before everybody else.
I love a nap.
I just have never had any use for it. It drives me absolutely, it drives me nuts to sleep.
You need to wash your brain, Dan. Wash your brain.
I just get so bored. So, all right. Well, Caitlyn, thanks for being here today. Thanks for talking about sleep.
Happy to do it.
I did think it was interesting. We were all late for the podcast because
we all slept.
So interesting.
That's April. It's the best segue if I've ever heard one.
I know. About them segues. We should do a segues by Dan. I didn't even do a speaking of sleep.
You didn't.
I know.
We just jumped right in.
So, April, thanks for recording this. Casey, thanks for doing all the editing. Big shout out to all our staff here at Countryside Equine Hospital because they're out there working away, making sure that we can do this.
Not waking horses up in the middle of the night. Not waking
horses up in the middle of the night. Thanks to our listeners out there. We really appreciate y'all listening in. And if y'all got any other topics you want us to cover, please send them in because we want to keep doing this. And so the more topics you can send us, the more things we can cover. And believe it or not, we actually do really enjoy doing it. I mean, I've been to so many times. I'd love for y'all to like and subscribe. But if you don't want to like and subscribe, you don't have to do that either. I really like you to, though. But we just want to keep getting information out there and hope to have our own small effect on the horse world and make this world a better place for horses every day. So to all our listeners, thank you. From all of us here at Countryside Equine Hospital, y'all have a great week. Take care.